also live both on Instagram and YouTube both. So there were a lot of again questions regarding in relation to fever and what we will think about remedies. But let us all first have some question answers. Then I'll start something on the fevers. Yeah, good afternoon, Dr. Lisa. So let us have some question answer session immediately because we have only half an hour because I have to have a different seminar after 3:30. So let us see some of the questions first and then we will see. Good afternoon, Dr. Desha. In fever, now there were a lot of questions regarding what to start in fever because there was uh, collapse during fever. Yeah, okay, we'll do that. What happens whenever we are treating a case, and whenever we are treating a case, especially of collapse, it is very important. It is very important to get the remedy right on the first instance. You know why? Because the time is very short and we have to give the results immediately. Whenever the word collapse comes, of course, the first thing that everybody should remember the first remedy, that is camphor. And I'll just tell you the simple mater medica first so that we can again see some more remedies about the collapse condition. And very well asked questions. We'll start with this part in the fever. In collapse condition, camphor is the most very, very important remedy. Good afternoon, Dr. Kuchar, Dr. Borkar, Dr. Abhishek, Dr. Hussain, Walaikum Salam. In camphor, now whenever you want to prescribe camphor, remember one thing: sudden attack of vomiting and diarrhea. The patient comes and tells you, till morning I was fine and suddenly diarrhea and dysentery started and now I am totally collapsed. The body is absolutely cold and there's great coldness of the surface with sudden and complete prostration of the vital force. That is the first indication of camphor. First. Second, the surface of the body is cold and face is pale, blue lips, livid, and there's profound prostration. And the patient is extremely sensitive to cold air. This is a very, very important symptom of camphor. Whenever you have patient extremely, I'm using the word extremely, or you can say exceedingly sensitive to cold air, Hipparsulf, Calimure, Sorino. Yes, last time I told you something about Sorino. I hope you remember that. So these 3-4 symptoms are very, very important symptoms of camphor collapse condition. And of course, the persons, they are physically and mentally very weak and irritable. So these are the basic symptoms of camphor if you want to prescribe on collapse condition. The next remedy that should come to your mind, of course, is second, Carboveg. Again, Carboveg chili remedy, and Carboveg is a condition where the patient also has symptoms where the patient is very cachetic, whose vitality have been exhausted and weakened. And it is said very beautifully, that persons who have never recovered from exhausting effects of some previous illnesses, that could date back to asthma or measles or anything, but that, or typhoid, anything. That is basically a collapse condition. In case of Carboveg, the patient suddenly falls down, the BP falls down, the patient cannot breathe, there is a lot of sinking in the abdomen, and when the patient, if you ask a question also, the patient is not able to answer. That's a collapse condition of a Carboveg patient. And the face is like very Hippocratic face, very pale, greenish yellow, and there is cold sweats. That is an important indication of Carboveg. Next remedy that should come to your mind is China. Now, China, again, if you have read in China, there are a lot of other conditions of China, but there are few symptoms that you should be able to understand and see. In China, you have to understand, for persons who are once very robust, they have become debilitated, they have become broken down from exhausted discharges. This is Carboveg. Don't always think about phosphoric acid. We can come to phosphoric acid also, but this is Carboveg. China. The patient's broken down, debilitated from exhausting discharges. This is again a very important symptom of China. And the face, Hippocratic face, sunken eyes, margins, and the margins, there are blue margins, pale, sickly expression. It is the expression of China. And of course, there is so much debility that there is a lot of trembling, sensitive to touch, sensitive to pain, sensitive to draft of air. The whole entire nervous system is extremely sensitive. That is that is China. So these are the 3-4 remedies. Of course, then we have veratrum alb, then we have veratrum viridi, then we have tobacco. So if I think I have told something about tobacco and the tobacco last time. Let's see something about veratrum alb. It is said in veratrum alb, it is adapted to disease with rapid sinking of vital forces, and there is complete prostration and collapse. Rapid sinking of vital forces, complete prostration and collapse, and cold perspiration on the forehead. Cold perspiration on the forehead with nearly all complaints is veratrum alb. If there is cold perspiration in the whole body, the remedy becomes tobacco. And veratrum alb patient cannot bear to be left alone. मतलब अकेला रहना चाहेंगे नहीं, but बात भी नहीं करेंगे. This is important, that the patient cannot bear to be left alone and yet refuses to talk. That is a very important indication of veratrum alb. Again, the face pale, blue, collapsed, features sunken, Hippocratic face, and red while lying, becomes pale on rising. That is veratrum alb. You see a patient, you go for a visit and see he has red lips, eyes are good, reddish, this. But when the patient gets up, the face becomes totally pale, the lips becomes pale. That is veratrum alb. And the thirst is intense. It is said it is unquenchable thirst for large quantities of cold water, or you can say cold drinks. The patient wants everything cold. It is said that the veratrum alb patient basically has craving for acids or refreshing things. Whenever refreshing thing comes, think about veratrum alb and phosphoric acid. One more symptom very important for veratrum alb is icy coldness. You touch the face, icy cold. You touch the tip of the nose, icy cold. You touch the feet, icy cold. You touch the legs, hands, arms, and many other parts of the body, icy cold. And this coldness feeling is there in the stomach also. Coldness feeling in the stomach also. Whenever you find this coldness feeling in the stomach, do think about veratrum alb and also think about tobacco. One more symptom which you have to think about veratrum alb is violent vomiting and profuse diarrhea. Both are present. Vomiting, excessive and nausea, and great prostration. That is also a very, very important symptom of veratrum alb. Hence, it is written that it is a very important remedy for cholera. So these are the few remedies which are very, very important in conditions of collapse in fever. Very well asked question. Sir, had you had sent the case of, I hope Dr. Lisa, this suffices your fever collapse in fever. The 4-5 remedy is very important, and this I had to discuss today, but you just asked the question, so everything is taken care of. Dr. Borkar, good afternoon. You had sent a case on WhatsApp for acne. Could you tell me the remedy? I don't remember, Dr. Disha, but after the YouTube, I'll see the case and then get back to you. Okay. Good afternoon, Dr. Sachdev, Dr. Bilwalkar, Dr. Vishaka, Dr. Vishal, Dr. Camphor. Which potency? Normally, I use LM potency because I have camphor LM potency. If I did not have LM potency, I used to give camphor 1M potency. Good afternoon, Dr. Vishaka. Yeah, Dr. Lisa. Hello, Dr. Alexander. So these were the symptoms basically which I wanted to share in collapse in fever. So see what happened. We have a lot of cases in this season. Gala kharab, like irritation in the throat, difficulty in deglutition, lot of salivation, fever, and weakness. These are the very common symptoms of fever which we are getting today. And in fever, see, it is very, very important to understand how you differentiate fever. So, and dose of camphor 1M. Whenever I am prescribing 1M, I'll give single dose and wait for the results. If the results come, then I repeat the dose. I had a case where there was the patient had a lot of that collapse condition in camphor. So I had given that patient 1 m potency repeated every half an hourly for 3 doses because the patient was on the telephone. So the patient came out very well. Fever, what you had, I was just telling you something about fever. In fever, you have to differentiate whether the fever is painful or painless. If you are able to differentiate painful and painless fevers, then you can always have remedies which are very few. For example, painful fevers, always think about painful fevers, remedies like bryonia, cantharis, rustox. Painless fever, phosphorus and phosphoric acid. Relapsing fevers, the patient says when you give medicine it is better, but after 2 days the fever comes back again. Relapsing fevers, very very important remedy, calcarea carb, very very important, ferrum metallicum and sulfur. No, Dr. Lisa, LM potencies are not weak. Do read aphorisms in Organon 248 where Hahnemann has said that in case of emergencies you can use LM potency every 10 minutes, and it is said that LM potency 07 or 08 is as good as 1M potency. So if you feel that it is very mild or not good, you can start directly LM7 also. But it is very strong and it definitely works even in the very acute condition. It works beautifully. So do try that. It definitely works. Yeah, so I was just telling something about that fever. Painful fevers, painless fevers, relapsing fevers. There are some fevers where the patient says that when I perspire, the fever comes down. So fever is better by sweat. If that is the condition, think about arsenic album, lycopodium, and rustox. So there are some things. Nodes in vocal cord, voice slow of 10 years boy. Yeah, whenever you find that there are nodes on the vocal cord, of course, I have never seen that the acute medicine works. But normally, in case of children's for nodes in the vocal cord, I have got results with few remedies which I have used in my practice. That is tuberculinum, calcarea iode, bromium, cocculus indicus, and phosphorus. Or then I have used either calcarea phos, natrum phos in this kind of condition. So these are basically few remedies which I have got very good results. But again, I have never used a specific remedy for a node. So if you could tell some symptoms regarding the nodes, defining symptom or of the patient, then it will be better for us to understand. There are some fevers, it is said. I'll just complete something about now fever when it comes with a lot of shivering. Now this type of fever, we have a lot of fevers with a lot of shivering. Now you have to understand how is the shiver. Too much shiver, as if it is like the patient has to use a lot of blanket. Then think about Eupatorium perfolium. Lot of fever, shivering and acidity, China horse. Just basic shivering in between, simple shivering, arsenic album. So these are basically how you will differentiate these type of fevers. So these are few symptoms and the few remedies which are basically I have seen in my practice in cases of fever which have worked very well. Some patient comes to you where the fevers are very high, high pyrexia. In that case, do think about pyrogenum, aconite, baptisia, China horse. Okay, and fever with cold, hands are very cold. Then think about thuja. And one fever of gastric origin. Whenever there's fever of gastric origin, do think about pulsatilla, baptisia, ipecac, ferrum phos, antim crude, and arsenic. So in broad senses, these basically are the entry points of fever and the fever remedies and the fever symptoms which I have seen in my practice. Of course, every patient then will have some symptom which are very uncommon or very defining to that patient and disease. Pick up that symptom and then prescribe. Okay. Thank you. Okay, nodes. In chronic case of fungal infection, can we give LM potency of basilinum? Definitely. Why not? You must give. In fact, in LM potency, whatever experiences I have, I first of all, treating fungus is really very difficult, and because uh, it is the patient has to maintain that hygiene. But if the patient is working in the office for 8 hours, 10 hours, then what happens that the area becomes very moist, and then basically that itching is there. So whatever we are prescribing, it is important that the patient should maintain that hygiene, that the area should be dry. it has to be bathed with hot water, so that automatically that area becomes dry. And I prescribe nowadays LM potency because I have to repeat that dosage. Lot of patients or most of the patient comes to us for fungus after taking allopathy treatment, taking lot of allopathy medicines and lot of allopathy ointments application like fluconazole, ketoconazole, and they come and they say that we had taken medicines, the patient is better till you take medicine, then again back to square one. So in these cases, I do use LM potencies of Basilinum, of Teucrium maramverum. In fact, I have got also good results with LM potencies of Azadirachta indica and Echinacea also. So you can definitely give LM potency in fungal infection. Gastric fever, did you say ferrum phos? Yeah, in gastric fever, I did say ferrum phos. Ferrum phos. It works. See, it is said that ferrum phos works basically for the first how to start. Whenever you have basically see, whenever there is a fungus in the body, that means the body's immunity has got low. So when the body's immunity has gone low, then basically the fungus starts coming in the body. First of all, my suggestion would be to take the whole case, and in those cases basically we will be able to understand which remedy, acute remedy, which I was asking, which I have used in my practice, where in my camps, that when there are a lot of patients and I could not take the case, so I use with some minor differentiation the remedies Azadirachta or Echinacea or Teucrium or Sepia or Tellurium with good results. Yeah, the ferrum phos, basically, if you want to understand ferrum phos, there is one beautiful line written in Boric Mater Medica. It is written that in the early stage of febrile condition, it stands midway between asthenic activity of aconite and belladonna and the asthenic sluggishness and torpidity of gelsemium. This is ferrum phos. The typical ferrum phos subject is not full-blooded and robust. Remember that. It is not full-blooded and robust, but nervous, sensitive, and anemic with false plethora and easily flushing. These are the important symptom of ferrum phos. Yes, it works well. Remember what I have told you. Remember this sentence. A typical ferrum phos patient is not full-blooded and robust. He is nervous, sensitive, anemic with false plethora. With false plethora. Prostration is marked. Face is more active than gelsemium. Remember, the face is more active than gelsemium, and the superficial redness never assumes the dusky hue of gelsemium. Remember these 4 or 5 lines of ferrum phos, you will never be able to miss out a ferrum phos patient in your practice. I hope you understood what I wanted to tell you about ferrum phos. Yes, 6-sensec and 12x biochemic also works very well. Left-sided headache affecting the eyes and ears, throbbing, pulsating, moves the head, lying down with nausea, aversion to noise, weakness of pain. See, whenever you are prescribing for headache or migraine type of headaches, these symptoms are very common. That nausea, vomiting, and so it is very important to understand how does the patient react at that time of headache. This is important. So can you tell me something? How does the patient react? Because see, if you have a classical patient where the patient comes and tells you lies down, yes, but you see, lying down with rest is something very common again for a migraine patient. But when the patient lies down with head low or head high or head straight, now this symptom then basically becomes a very interesting prescribing symptoms for that patient. Or for example, the patient wants to lie down and is better by draft of air, but it is aggression in the AC, or is better in the cold air, but aggression draft of air. So these are a lot of other symptoms that you have to in fact ask the patient, and then you'll be able to understand and prescribe the similimum. Better by lying on the painful side. Now, so whenever the patient comes and tells you that there's general headache, bending side to the one better lying on painful side. You must think about few remedies again. Can you have some more symptoms? Some more symptoms. See what happens in case of migraine. There will be a lot of cases of migraine where the patient says that whenever somebody has pressure on does pressure on my head, I feel better. I feel better by bandaging very tight. The more the tight, the more it is better. But I have seen a lot of cases where I have used these modalities. No, it does not work because in most of the cases I have seen these basically are very common symptoms. You do think about okay, you can think about remedies. I'll tell you some of the remedies which are very wakes up from the pain in the middle of the night. Yeah. So the pain is so severe. The pain is so severe that it wakes the patient. Now this is so important. This is very important. That the patient that the pain the headache is so severe that the patient wakes up with pain. Whenever you have this type of symptom, few remedies which are very very common that you have to remember, and few remedies which are very very rare that you remember. You must remember, of course, remedies like, see, whenever the remedy has lot of congestion in it, whenever the remedy has lot of congestion in it, that means those remedies have that pain from waking. Think about remedies like calcarea carb. Think about remedies like now then you have to understand waking at what time. And if that is there, of course, then nothing like it. So think about calcarea carb, think about sulfur, think think about kali carb, think about coccus coccus cacti, think about lachesis, think about crotalus. These are the very very common remedies where the patient has to wake up because of the pain. Okay. Any other? And of course, do think about the remedy Kali Phos. A Kali Phos patient has so much pain that he keeps waking because after sleep he has to wake up so many times because of the severe pain. So Kali Phos will rest the nerves and give relief to the patient. I hope that's okay. Worse from motion is again is worse from motion, worse from noise, worse from light, all common symptoms. Sir, for uric acid with stiffness of small joints, no swelling. Whenever you are prescribing, whenever you have a remedy to prescribe for uric acid, it is written in a Mathematica that lot of it is first you must think about a very important remedy, that is benzoic acid. So if you have never used benzoic acid, it is written that most of the cases of high uric acid should resolve with benzoic acid. So do think first about benzoic acid. And of course, after benzoic acid, do think about colchicum, do think about lycopodium, do think about Arenia didana. These are the very very common remedies that you have to think when you are prescribing in case of high uric acid. Okay, so you need the remedies when the patient. Okay, so when the patient has to wake up, do think, Dr. Alexander, I'll just repeat it again. Sulfur, Naxomica, lachesis, Kalicarb, China, arsenic. So I hope, Dr. Joshi, you got the answers. Think about benzoic acid and those type of benzoic acid, lycopodium, Arenia didana, colchicum. These are very important remember, but it is written in benzoic acid. Dr. Nash writes and Dr. I think Clark writes, Dr. Allens writes that if you have never used the most of the cases of uric acid should get resolved or should get better by giving benzoic acid. It's a wonderful remedy. Do read benzoic acid also. Yeah, welcome. So it's already 3:30. Can we have few more questions? I have to. I just had specific half an hour today. Fever remedies other than aconite, belladonna, arsenic, bryonia, with other top remedies. Of course, the top remedies basically are with high you. Yeah, you must with severe acids. You must think about China ars in those cases. Do think about lycopodium in that case, Dr. Joshi. Dr. Gopal, good afternoon. Fever, and apart from that, you must definitely think about remedy. I don't know whether you have used that remedy in fever. Eupatorium perfolatum will give you very, very good results. Eupatorium perfolatum, first remedy that you should think about in fever. China ars has given me better results than arsenic, So think about China ars. In very prodromal stage, when basically there is lot of sneezing and fever, think about Justitia adatoda. If you have not used Justitia adatoda, that means you have missed lot of cases of fevers which have just had a symptom of fever and you have prescribed the patient ferrum arsenic. So Justitia adatoda again is a very important remedy for fever, though rare but important. Allium cepa, simple remedy but important remedy for fever. Euphrasia, again a very simple remedy, important remedy. And one more remedy what I would like to add is aurum triphyllum, where a typical symptom the patient will have, that the patient will have lot of coryza but dryness of nose. That is aurum triphyllum, and the whole nose from nose is basically the upper lip basically have been cut and it is very reddish. Soreness is there. Justicia I have used in 200 potency. In 200 potency. These are again very rare remedies, but definitely very, very good remedies in cases of fever. In fever, see, in fever, there are a lot of remedies, but what presenting symptom the patient is brought to is very important treating fever. Yeah, so in cases of eczema, see there is a wide varieties of remedies for eczema. You can start with simple graphitis, miserinum, sulfur, silicia, petroleum, what do you call, cystascan, calcarea. There are a lot of other remedies. Some have dryness, like petroleum has dryness, miserinum has dryness also, and that discharge like graphitis, abdominal discharge, sticky discharge, sulfur is all form of that. So there are, depending on the case to case, we basically treat cases of eczema. Justicia, yeah, Justicia, Justicia, adatoda, yes, right. Sir, male 47, great debility, even few steps making him too hard to take breath, climbing HB 8.9. So whenever these symptoms are there, where there is a lot of debility, you must think about a few acids. The first is muriatic acid, second is arsenic album, and the third is China ars. Benzoic acid I have used in 30 potency. Patient 65 years, female, itching all over the body without eruptions day and without eruptions day and night, sometimes bleed after scratching, violent itching, no relief from giving sorinum, sulfur, arsenic, alumina, rumex. Please suggest. Now see, whenever you have cases where the patient classically comes and tells you that there is lot of itching, okay, and of course itching could be burning XYZ, but see, you have written a very beautiful, you have very written a beautiful symptom, and that's a very nice thing, that itching without eruptions. Now, itching without eruptions, if a case comes to you, there are very few, there are good number of remedies, but there are few remedies which basically works very well. One is Dolichus. Now, if you have heard the remedy about Dolichus purpura, or it is one more name, I think Mucona purpurea. So the dolysis is a very, very important remedy that you have to think when there is itching without eruptions. Second remedy, itching without eruptions, is gelsemium. Third remedy, itching without eruptions, you must think about mercury. Fourth remedy, itching without eruptions, you must think about sorinum also and sulfur also. Sciatica, left side. Now see, whenever you are prescribing for sciatica, now sciatica pain basically will have these type of symptoms, migratory lightning like pain and XYZ type of pain. But now you have given specifically sciatica of the left side. Do think about ammonium mure, calibichrome, calicarb, and hypericum. Very, very important remedies. It's already 3:30. I'll just take one more question because I have to reach for one more seminar at a different place. So I'll just take one more question before I close off. Any one question, anybody? Any question? And sorry, I did not see in Instagram today. Good afternoon, Dr. Amit. Dry eczema of color. Do think in this case, do think about petroleum. Do think about hydrastis. Very very important remedies. Dr. Amit. Basically, we took the this time question answer session was only for half an hour, so we've already finished half an hour, and I have to rush for one more seminar. So, guys, thank you for your time, and meet you tomorrow. Yeah, I did say ammonium carb. Sorry, I said ammonium mure. I said ammonium mure, not ammonium carb, Dr. Lisa. Ammonium mure, not ammonium carb. So, guys, thank you so much. Thank you for joining, and I enjoyed as much as I hope you must have enjoyed hearing my queries, and I hope I am able to solve some of your queries in your practice. Thank you so much.